Hi everyone, thanks for coming to our presentation. Kathy Roth and I will be talking about the benefits from a research co-design partnership between academics and consumers. And the project which we're talking about, where we were partners in, is called the Promoting Independence Through Quality Dementia Care at Home, or the PITCH project, where we used co-design to create an evidence-based dementia specialist training program for home care workers. So we identified that home care workers would like more dementia care training. So when they go out and look after people in the community, they have up-to-date knowledge about, their best practice care. So why did we choose co-design for this project? So really, when we thought about a training program for home care workers, we really wanted to bring together the people who would affect, so the service users and also the people delivering the service, to effectively, for us to conduct relevant and useful research, which leads to enhanced outcomes and outputs. We wanted the quality of home care service to increase, especially in a very competitive market. We also wanted our research to be relevant and applicable in the real world and be used. And really what we're aiming for as researchers and academics is really to create impact. And we wanted our results to be useful, effective, and sustainable in the industry. So our philosophy for co-design was based on the Sanders and Stappers approach to co-design, where really all of our co-designers are partners. And we have shared decision-making, we have the equal partnerships and the emphasis on the creativity and innovation. We engage end users in idea generation as well as the actual process of development of the education package in this instance, and really embedding everyone together in our collaboration, co-design and co-creation. So in the bubbles at the top, you'll see, the methodology that we used for our co-design. We had 2 focus groups, 36 in-depth interviews, 4 co-design workshops with 46 people, a project management group and a project advisory group. And the people that made up these co-designers were people with a lived experience of dementia, of caring, and also home care workers, service managers, case managers, and education specialists, clinicians, and researchers. So all together, we created the Art of Dementia Care program that you see down there. So I met Kathy as part of our project advisory group. You can see Kathy there in the middle with her husband, John. And they are our group that help us with everything. They help us with project governance, and they're partners in direction and development. They advise on policy, practical implications. They help us disseminate the project. They look at all our documents, and we co-present like we are now. We co-author papers, and we also co-submit big grants together. And really, the benefits of co-design for me and for the project, it really brings together the expertise, the insight of the people that we're affecting with our research, and it really has increased everybody's skills in terms of how to collaborate with people from different industries for a common project. It improves policies, enhances practices. It really has made my work much more meaningful, because I can see how this work is affecting people in the real world. And our relationships that we've developed are very strong and enduring. Kathy.
Health is a very good fit for co-design in research. Our cohort is one that has been diagnosed with early Alzheimer's or related diseases. They're still at the prodromal stage. They come from very high functioning professional backgrounds, and they seek out peer level interaction and stimulating environments. In particular, they have inquiry minds. They seek answers and they're very innovative and strategic in their thinking, so their input is invaluable. We focused on professionals with PALS because currently they're not served by many opportunities. Their diagnosis has brought them total and instant disconnection, and being treated professionally again, seeking of their opinions, gives them dignity and self-respect. Their intellectual stimulation may create new neural pathways, and their input is invaluable. So we stimulate them with bi-monthly boardroom meetings, always in the mornings. We have high-powered speakers so that they're mentally challenged. On alternate months, though, we have small industry groups or coffee and discussion groups, and it's at those discussion groups that we cover a myriad of medical, social, and industry type discussions, and that's where the input is able to be fed back to NARI. We love working with NARI. We're an excellent team, and we appreciate the opportunity to give input into this invaluable project and others.
Thanks, Kathy. So when we were designing our slides for this presentation, I really wanted to see, what our goals were. And, I wrote down academic goals that I like to achieve in research for this, and I talked things like recruitment is important. We want to have impact. We want to increase skills. We want our work to be meaningful, and useful. And then I asked Kathy, Kathy, what do you want to achieve in being a researcher? And she said she wanted to contribute to society and help future generations or family members at the moment to feel like a valued member of society, and to gain greater insight into new treatments, and to turn personal disadvantages into a positive. And really, when I was typing this into the PowerPoint presentation, they are really shared goals and common goals. The consumer goals could easily also be the academic goals, and vice versa, where I think this really speaks to the value of co-design and really highlights that our goals are shared goals and common goals, and co-design can really help us achieve that. So thank you very much for your attention. Please contact us with any questions. Otherwise, we'll see you at the Q&A this afternoon.